Today we are going to talk about a topic that is incredibly important for global health: HIV and AIDS. It is vital that we all understand what these terms mean. HIV stands for Human Immunodeficiency Virus. This is the virus that, if left untreated, can lead to the condition known as AIDS. AIDS stands for Acquired Immunodeficiency Syndrome. Think of HIV as the cause and AIDS as the potential outcome. For many years, a diagnosis carried a heavy weight of fear and misinformation, but science has made incredible progress. With the right knowledge and medical care, people with HIV can live long, healthy and fulfilling lives. It's crucial to separate the virus from the syndrome. A person can be living with HIV without having AIDS. HIV is the microscopic intruder that enters the body. For a long time, sometimes for many years, a person with HIV might not feel sick at all. They can go about their daily lives, work, and relationships. However, the virus is quietly at work inside their body, targeting the very system designed to protect them from illness. This is why regular testing is so important. Knowing your status is the first step toward taking control of your health and preventing the progression to AIDS. So, what exactly is AIDS? It is not a separate virus or disease on its own. Instead, AIDS is the most advanced stage of an untreated HIV infection. This stage is diagnosed when the immune system has been severely damaged by the virus. A doctor will diagnose AIDS based on a person's CD4 cell count, which are key immune cells, or the presence of certain opportunistic infections. These are illnesses that a healthy immune system would normally fight off with ease. But for a person with a compromised system, these infections can become very serious and even life-threatening. The journey from HIV infection to an AIDS diagnosis is not inevitable. This is the most hopeful message I can share with you today. Modern medicine has completely changed the outlook for people living with HIV. Through consistent treatment, the virus can be managed effectively. This means a person's immune system can remain strong, and they may never reach the AIDS stage. The distinction between HIV and AIDS is not just medical terminology. It represents a story of scientific triumph and the power of proactive healthcare. It underscores why understanding this topic is a responsibility we all share. To protect ourselves, we must first understand how HIV is transmitted from one person to another. The virus is not spread through casual contact like hugging, shaking hands, or sharing a meal. It is not transmitted through the air or by mosquitoes. HIV is found in specific body fluids: blood, semen, rectal fluids, vaginal fluids, and breast milk. For transmission to occur, one of these fluids from a person with a detectable amount of HIV must enter the bloodstream of another person. This can happen through a mucous membrane, like those found in the rectum or vagina, or through direct injection into the bloodstream. The primary ways HIV is spread are through specific activities. The most common mode of transmission globally is unprotected sexual contact with a person who has HIV. This includes vaginal and anal sex. Sharing needles, syringes, or other drug injection equipment is another significant risk factor, as it can directly transfer infected blood. A mother can also pass the virus to her child during pregnancy, childbirth, or breastfeeding, although this is now very rare in places where mothers have access to proper medical care and treatment. Understanding these specific routes is key to demystifying the virus and focusing on real prevention methods. Once inside the body, HIV launches a targeted attack on the immune system. Its main target is a specific type of white blood cell called the CD4 T cell, often referred to as the general of the immune system's army. These cells are responsible for coordinating the body's defense against all kinds of infections and illnesses. HIV is incredibly cunning. It invades these CD4 cells and uses their internal machinery to make copies of itself. This process not only creates more of the virus, but also destroys the host CD4 cell in the process. This is the central mechanism of the disease. Over time, if left untreated, this relentless cycle of invasion and destruction takes a heavy toll. The number of CD4 cells in the body steadily declines, while the amount of HIV, known as the viral load, increases. As the CD4 cell count drops, the immune system becomes weaker and weaker. it loses its ability to mount a strong defense. This leaves the body vulnerable to a wide range of infections and certain cancers that it would normally be able to control. This weakened state is what defines immunodeficiency and marks the progression towards AIDS, highlighting the urgent need for intervention. The development of antiretroviral therapy, or ART, is one of the greatest public health achievements of our time. ART is not a cure for HIV, but it is an incredibly effective treatment. It usually involves taking a combination of medicines every day as prescribed by a doctor. These medicines work by stopping the virus from making copies of itself at different stages of its life cycle. By blocking this replication process, ART drastically reduces the amount of HIV in the body. This is a game changer for anyone diagnosed with the virus, turning what was once a terminal diagnosis into a manageable chronic condition. The main goal of RT is to reduce a person's viral load to an undetectable level. Undetectable means that the amount of HIV in the blood is so low that standard laboratory tests cannot find it. Reaching and maintaining an undetectable viral load is the key to living a long and healthy life with HIV. It allows the immune system to recover. With the virus suppressed, the CD4 cell count can rebound, strengthening the body's ability to fight off infections. A person on effective ART can have a life expectancy nearly the same as someone without HIV. One of the most profound discoveries related to ART is the concept of undetectable equals untransmittable, or U equals sign U. Major scientific studies have confirmed that a person with HIV who is on ART and has a sustained undetectable viral load cannot sexually transmit the virus to a partner. This is a powerful message that helps to dismantle the stigma and fear surrounding HIV. It empowers people with HIV to have healthy relationships without the fear of passing the virus to their loved ones. It also reinforces the immense importance of adhering to treatment consistently. Starting treatment as soon as possible after a diagnosis is crucial. The earlier you begin ART, the sooner you can suppress the virus and prevent it from damaging your immune system. Early treatment leads to better long-term health outcomes and reduces the risk of developing HIV-related illnesses. It also lowers the risk of transmitting the virus to others. Today, health guidelines recommend that everyone diagnosed with HIV should start treatment right away, regardless of their CD4 count. This proactive approach is fundamental to both individual health and public health. Prevention remains our most powerful tool in the fight to end the HIV epidemic. There are more ways than ever to reduce your risk of infection. Consistent and correct use of condoms during sex is a highly effective method for preventing the transmission of HIV and other sexually transmitted infections. For individuals at higher risk of exposure, a prevention strategy called PrEP, or pre-exposure prophylaxis, is available. PrEP is a daily pill that can reduce the risk of getting HIV from sex by about 99% when taken as prescribed. It is a vital option for protecting your health. Another critical prevention tool is PEP, or post-exposure prophylaxis. PEP means taking ART medicines after a potential exposure to HIV to prevent becoming infected. PEP must be started within 72 hours of the exposure, and the sooner it is started, the more effective it is. It is an emergency measure, not a regular prevention method. Knowing about PEP is important in case of an accident, such as a condom breaking or sharing injection equipment. These prevention strategies, from condoms to PrEP and PEP, provide a comprehensive toolkit for staying safe and taking control of your sexual health. Alongside prevention, early detection is absolutely essential. The only way to know your HIV status for sure is to get tested. Many people with HIV do not have any symptoms for years after they become infected. During this time, they can unknowingly pass the virus to others. Early symptoms of an acute HIV infection can appear 2 to 4 weeks after exposure and might feel like a bad flu. They can include fever, chills, rash, night sweats, muscle aches, and a sore throat. Since these symptoms are common to many other illnesses, testing is the only way to confirm a diagnosis. Regular HIV testing should be a normal part of everyone's healthcare routine. The Centers for Disease Control and Prevention, or CDC, recommends that everyone between the ages of 13 and 64 get tested for HIV at least once. People with certain risk factors should get tested more often, such as once a year. Knowing your status is empowering. If you test negative, you can take steps to stay negative. If you test positive, you can start treatment immediately to protect your health and the health of others. Let's work together to end the stigma, encourage testing, and support everyone in living a long, healthy life.